Welcome again, listeners at the SmartEducation podcast. Not so long ago, we did a podcast with Dr. Merv Travers, and today we're doing another one with a really special guest. Today we have with us Dr. Richard Willy. He's an assistant professor in the School of Physical Therapy, University of Montana in the States. He received his PhD in biomechanics and movement sciences from the University of Delaware and his Masters of Physical Therapy from Ohio University. In addition to his research, Dr. Willy has been a clinician for 18 years, specializing in the treatment of the injured runner. And his research aims to develop clinically effective treatments for example, patellofemoral pain syndrome, Achilles tendinopathy, and tibial stress fractures. Besides publishing in peer-reviewed journals, Rich is a national and international presenter of his research and clinical expertise on how to evaluate and treat the injured runner. And that's exactly why we've invited Rich to come to Belgium and teach for SmartEducation. He's giving his lecture today and tomorrow on restoring load capacity in the injured runner as a running smart masterclass for physios who have a special interest in running. That being said, welcome, Rich. How are you?
I'm doing well. Thank you very much. It's a very nice introduction. Thank you very much. And
I hope everything was right what I was saying.
Oh yes, it's perfect. Okay. Perfect. Yes.
How's your voice? Because
it's good. It's good. Yeah, I've got a little bit of a head cold, but it's good.
Yeah. Now you can't believe, Rich, how glad I was this morning waking up, finally meeting this expert, and now you're sitting right in front of me.
Thanks. It's a real honor to be here. This is my first time to Belgium, and it's been a great first day, and it's just been really great to work with both of you heading up to this course, and all the clinicians who attended today have been fantastic. So it's been great to meet everybody.
Okay, looking forward to tomorrow already. Now, for our listeners and our followers, it's a great opportunity, I think, to meet the expert, not in person, this expert on running. And I'm going to try to pick your brain a little bit now in the next couple of minutes, Rich. It's going to be all about running analysis, running injury, and running shoes.
Sounds great, Stan.
How sounds that? Good.
Sounds perfect. Yeah. Let's do it.
Okay, first of all, during the course, I loved how you gave these different take-home messages throughout the course. Quite a few good ones. No, actually, all of them were good ones. And given my bias as a SmartEducation founder, I'll pick this one out immediately. Patient, or in this case, runner's education is a must. Tell me more.
Yeah, I think that one of the big reasons why I feel that patient education is so important is for two reasons. First, all running injuries can typically be traced back to some sort of mistake that the runner has made in their running and their training practices. Maybe they've increased their how much they're running per week, or maybe they've increased how much hill work they're doing or how much intensity they're doing. And often runners don't have a good grasp on how that might affect their risk for experiencing different injuries. And so another reason why patient education, I think, is so critical in this group is because runners often have beliefs that are kind of reinforced in the popular running media. That things such as stretching or perhaps maybe improper shoe prescription might be the main reason why they're experiencing their running injury. But when we look at the literature, there are often more important reasons why they're getting these injuries. And in particular, it'd be that training load error where they're committing some sort of training error with their, how much they're doing. Yeah. So I think spending some time working with runners and helping them understand that, I think, is so critical, because otherwise, when they get done with us and go back to running, they're more likely than not, they're going to make that same mistake again if we can't help work with them to help them understand the reason for their injury.
Yeah, of course, runners come to us when they are injured. Mm-hmm. I think we have a major important role in educating, not only to rehab them, but also educating them. And that's also why, just before recording this podcast, I asked Rich that he uses in his clinic patient leaflets.
Yeah, we do.
And those leaflets we'll be looking forward to try and translate them, and then maybe distribute them throughout the Belgian physios. And I can say already that Rich agreed on this, so you'll be looking out for this, everybody. No, but those patient leaflets, it's a great way to get the message that you want to educate, how you want to educate your runners to get that across.
Yeah, absolutely. I think that pamphlet, I think it's important to give runners, and it's just a single page. It's important to take them or give them something that they can take home with them because, runners, when they come to see us as clinicians, it can be very overwhelming for them. They're receiving a lot of information. And I think to give them something that they can take home with them and spend some time reading over and mulling over some of the reasons that we're suggesting, I think that that's something quite important. So yeah, we've created a couple of these pamphlets, and we've worked really hard to use terms that the average runner can use. I think that's super important that we're not using more medical or scientific terms that no one really understands. And I think that's just an important point.
Yeah. Well, another one of those take-home messages, and one that I also find important to discuss with my running patients, is about load management, of course. And I love you gave a great example about that when trekking distance alone, you miss a lot, you miss much. There was this, I think it was the London Marathon, that you made the comparison between Geoffrey Kiryu and let's say your average bloke who runs the marathon. There was a huge difference between the number of steps and the cumulative contact time.
Yeah. So I think that when you look at endurance-paced running, injuries that you get when you're doing that activity tend to occur only when your foot's on the ground, which is a little bit different than sprinting. And when we look at the elite runner versus the average marathon finisher, the elite runner is going to have their foot on the ground fully 25% of what the amount of time that the average runner is going to have. Another way to look at that is that the average runner is going to have their foot on the ground 4 times as long to run the same distance. So those two runners are experiencing vastly different training loads.
Yeah, 4 times as long. It's huge. Well, that's what I also tell I hope you can agree, or is it? I'll ask you like this: is it fair to say to my male patient, a male runner who wants to run a marathon, I say to him, look, if you're not going to do this under 4 hours, don't even bother, because maybe it will be too much for your, depending on his his fitness level and stuff, but maybe it's too much for his body, for his joints, for his tendons.
Yeah, so we know that running is a very healthy activity for individuals to do. Running a marathon is quite healthy. Mm-hmm. We see that when you train for a marathon, markers of things such as your risk for cardiovascular disease decrease, and even joint health improves. Mm-hmm. And so while it's easy to kind of walk away from some of the statistics that I was just kind of quoting about how long one's foot is on the ground, the important thing, though, to think about is that the elite runner is probably going to be able to recover from that race and probably from their training sessions quite a bit faster than your average runner. Mm-hmm. But yeah, by no means are we saying that they shouldn't be doing these types of races. They probably just need to think about their training a little bit differently.
Mm-hmm. And take more time to adapt and train. Yeah, absolutely. Okay. Let's talk about running analysis a bit. And maybe I'm opening a big can here, but let's try I'll ask you to keep a short feedback on the quote, biomechanics matter.
So I think,
but not so much.
Yeah, it matters, but not so much. And so my background is in, I got my PhD in biomechanics. Mm-hmm. And so when I came out of the University of Delaware, I thought that biomechanics was the main reason why runners sustain running related injuries. Mm-hmm. But, now one of the things that I do, I treat runners, about 8 hours a week. And I can tell you that while it may be important, it's not the main reason why people get injuries. And typically it's just because of that running or that training load error that they've made. And so sometimes the runner's biomechanics matters, but a lot of times it doesn't. And when it does matter, it might just be that how that runner is moving is perhaps putting additional stress on one area of their body. So when they make that training load error, it's just that injury then is going to manifest itself in their knee if they have a certain running mechanic, or in the case of someone who is perhaps a forefoot striker, because they put so much more load on their Achilles tendon, that's where that tissue overload might occur, is down at the foot and ankle complex.
Mm-hmm, mm-hmm. And we also talked about running injuries and about the clinical examination, and you also mentioned that. Or you pointed out the difference between provocative tests versus diagnostic tests. There is a difference, of course, and to take an example of that, which one I also use a lot, and you can maybe tell the listeners a little bit about it. A really important one is the single leg hop test.
Yes.
And you make a selection between landing on the ball of the foot with this test and also landing on the heel.
Mm-hmm. Yeah. So
what is the difference? Because this was a little bit new for me.
Yeah. So when you hop, we typically get most of our hopping power from our plantar flexors. So that tends to load our calf musculature, our Achilles tendon quite a bit. And that can be really helpful if you're trying to understand that injury and trying to see if you can get some sort of a provocative effect. So you can then see if you can go get a better idea what the actual pain source might be. So the other way that I showed it was to hop, but then come down and land on your heel. Mm-hmm. And the reason why that's can be quite helpful is that what that does is it puts a load on the lower extremity that is actually quite a bit higher than if you were to go for a run. And it focuses that load through the bony structures. In this case, your calcaneus, and that load then kind of transmits up through your lower leg, your tibia, and perhaps your fibula, depending on how you're landing. So that landing on your heel very hard can perhaps elicit a bone type pain if that person perhaps has a bone stress injury.
Mm-hmm. Yeah, you are looking at quality of motion, but also trying to reproduce symptoms.
Yeah, that's right. Yeah. So a lot of times when we see a runner who has a plantar flexor type injury, they're going to hop, but they might substitute more of their knee extensors in, and then you'll see them flexing their knee a lot more. And they might be able to hop pain-free until you perhaps cue them into just hopping, just using their ankle, and then that's going to reproduce their Achilles tendon pain or their posterior tib pain. So how someone hops, I think, is super important, and it shifts that load around. And that can be really helpful in helping us kind of determine where their injury might be. And again, it's a provocative test. It's certainly not going to diagnose someone with a stress fracture. That's when we need to send them off for gold standard tests, such as an MRI. But it's a great place to start with our runners, particularly runners who are perhaps not able to go for a run that day because they're in a lot of discomfort or just haven't been running for a while.
Mm-hmm. Tomorrow we'll talk some more on running injuries, and I'll give it very good advice to the listeners here. Please go and listen to the BGSM podcast that Rich did a few months ago. It was on ITB pain. Would you mind, Rich, to summarize a little bit, because we don't have so much time?
Yeah, sure.
This podcast was a really good one. And I used it already in my practice, trying to give advice to my runners. There were some quite good clinical pearls in it. Can you elaborate a little bit on that?
Yeah, definitely. So I think first and foremost, IT band pain is, well, it can be kind of a bit of a mystery to most runners. There's typically some really good
and
clinicians as well. Yeah, it's a good point. It's a really confusing injury for someone to have, and it can be very tough to treat as well. But when you back up and you take a look at the biomechanics that loads that structure, and then we also know too that certain running tasks load that structure even more. So things like running downhill puts a lot of load on it. If you run on a single track trail, so not like a walking path, but a very narrow trail, that's also going to increase load on that structure. And so understanding those things can really help us understand why someone had that injury. But at the end of the day, we need to keep this runner moving. And that's one of the things that we stress in the course is do whatever you can to keep the runner running. If they can't run, you want to get them to do the next hardest thing. And a lot of people who have IT band pain can't run. And so what we want to do with them is we want to try to keep them moving as much as possible. And we use a lot of uphill treadmill walking. Mm-hmm. But from there, we progress very quickly into loading that structure. And we do a lot of weighted squats, particularly a weighted split squat, where they're loading the leg that's in the back. And the reason why they're loading that leg in the back is because that's the one that's going to have the most load on that IT band. And we want to kind of progressively increase the amount of load that this person can tolerate and gradually then return that person back to running.
Mm-hmm. Yeah, it's great stuff there. A personal question. I think we still have time. How's your marathon training going? Because you're training for the London Marathon in April.
Mm-hmm. I am running the London Marathon. It is April 26th.
No injuries?
I had some Achilles tendinopathy, and I did a pretty good job of earning that injury. So I got that injury because I went from running maybe 50 kilometers per week to jumping up to about 80 kilometers per week in just about 2 weeks. Mm-hmm. So I kind of, basically committed the classic running training error. And the other thing too is I live in Montana where it's pretty snowy. And so I increased my mileage just when we started getting a lot of snow on the ground and landing, I think, on that soft and uneven surface, put some different loads through my Achilles tendon that I just wasn't quite ready to tolerate yet. Yeah. So it's doing well now though. But.
Okay. Hope you'll manage to come and to do the finish in what time, or do you?
Oh gosh,
I have an idea already.
We got to put it. Yeah, we're going to put it down. So I would like to.
We can look in the when everybody is finished. I'll go and look for your name and then see if you made it or not.
Yeah, we'll see how it goes. Well,
3 hours.
Yeah, I would like to be around 3 hours. That's my goal. So
that would be great.
I'm 46, so I think if I can get under 3, that's doing pretty good. But I think that might be a bit of a stretch for me. We'll see.
We'll see. All the best with that.
Thanks very much.
Actually, it was only a small bridge towards my next question. You're gonna run that marathon, and did you figure out what kind of shoes you're gonna wear to run it? And prescription of shoes.
So it's actually been about a decade since I ran a marathon. So I've had some hip issues in the since then, and so I figure I'm probably about 4 or 5% slower than I was a decade ago. And so I fully plan on getting the Nike Vaporflies to make up that distance or that difference. I have no guilt about it. And to spend the money is something that I'm certainly willing to do. So I have no shame in there whatsoever.
No. But actually, I also wanted to know, and I'm sure that our colleagues who are listening, that they are interested in how you look at shoe prescription and what is important. Or not?
Yeah, I think shoes, when it comes to preventing injuries, are really kind of overthought. Mm-hmm. I think that
that was just the answer I needed.
Yeah. I think I think when you look at injuries or running, the risk of getting an injury, it hasn't changed in 30 years. And we've seen lots of different types of shoes come and go. We've seen like standard type shoes where we're matching the shoe for the type of foot a person has. We've seen minimalist shoes come along, so there's barefoot mimicking shoes. Now we're starting to see zero drop shoes, and then we're also starting to see these maximalist shoes, so shoes such as Hoka's. And it doesn't seem to matter what type of shoe someone runs in, they still are getting injured. The injury rates still are above 50% on an annual basis. Yeah. So when we look at the data, it doesn't seem to make a lot of difference that, what type of shoe someone runs in. So the best advice that we give people is to just go pick a shoe that feels comfortable for you. And that shoe might be a Hoka, or you might be more comfortable running in a minimalist shoe. Mm-hmm. And it really, the comfort part, I think, seems to make the biggest or the most sense to me. Yeah, I think that's the main criteria. And also making sure that making sure that that shoe fits. That's a thing that we see a lot with our forefoot injuries, that runners are choosing a shoe that is perhaps the toe box is too narrow or the shoe is too short.
But I also remember now that there was a tendency when it comes to differences in injury patterns or different shoes, maximalist versus minimalist shoes. And which injuries do you see more with? Well, more. There is a tendency with which injuries you see more with maximalist versus minimalist shoes.
Yeah, so I think that brings up a great point, and that's that when you change a shoe or even you change your running mechanics, you don't actually change the load on the person. All you're doing is shifting that load around a little bit differently. And so essentially, if you choose a minimalist shoe versus a maximalist shoe, you're probably just choosing a different injury to get. So a maximalist shoe, you might be a little bit greater risk for getting a knee injury. If you're running a minimalist shoe, of course, that's going to put a lot more load on your plantar flexors. So you might be more likely to get an Achilles tendon injury or a metatarsal stress fracture. But the overall injury rate between shoe types doesn't really seem to matter a whole lot when you look at the studies that are conducted well. And I think that's a really important thing, to think about. So if you've been someone who's had Achilles tendinopathy in the past or plantar flexor issues, plantar fasciopathy, a minimalist shoe might not be the best shoe for you. If you've had knee pain in the past, then maybe the Hoka might not be the best shoe for you either.
Well, look at the time. We were already talking for more than 20 minutes. I think it's time to wrap it up here, Rich. Because we need to go to the restaurant as well.
Yeah, let's do that.
I thank you really, really much because the time you want to spend in this podcast. I hope the listeners, I'm also sure that the listeners can take something out of it, and please do use that in your clinic. Once again, go and listen to the BGSM podcast and be looking out for the leaflets that we'll be distributing. And have some good runs, of course, because that's also the message, and that's the final message. Running is healthy. Yeah,
absolutely. Yeah, keep on running. Do whatever you can to keep it up.
Yeah. Thank you, everybody, and see you soon. Bye.